Hi everybody, my name is Dr. Daniel Roney. I'm a board certified chiropractic physician and I'm also a specialist in something called functional medicine. So briefly, functional medicine is the understanding that once a diagnosis is made, there are causes and or mechanisms that are creating the diagnosis and or the symptoms of that diagnosis. So in the allopathic world, as an example, a lot of times there's medication given to help maybe change physiology and help function a bit, but not necessarily addressing the causes. The very simple example I can give is blood pressure. And so if my blood pressure starts to elevate because of known causes, right, it just doesn't happen. Blood pressure goes up, go to the doctor, they give me blood pressure medicine, it brings it down. And that medicine does work pretty good with bringing the blood pressure down. The problem is twofold. Number one, that got me out of danger, meaning I lowered my risk for stroke and heart attack and things like that. And that's why, in the allopathic world, they want to bring that blood pressure down. And I totally understand that. The problem, though, is that it's just a Band-Aid. So if I went off of that blood pressure medication, my blood pressure is right back up. The point that I'll make is nothing was really ever done about the causes or the mechanisms that created the blood pressure to be elevated. And that's what healthcare is missing, in my opinion, significantly. And so this functional medicine approach, just using that example, is trying to understand what mechanisms are going on, that if we can understand and identify the mechanisms and we change those, then the blood pressure can naturally just decrease on its own. And hopefully the need for the medication becomes obsolete. That's the objective, okay? That's just keeping it as simple as possible. That's the functional medicine approach, okay? So as it relates to this chronic fatigue, chronic pain world, right? Our patient base is chronic pain, chronic fatigue, autoimmune conditions, fibromyalgia, thyroid malfunction, etc. Chronic headaches, just chronically not feeling well, okay? And so this video, what I want to teach you is the mentality of how to heal and also understanding, like we talked about, the conventional model versus this functional medicine approach. And this functional medicine approach in the alternative world is even different than a lot of times the alternative healthcare model, okay? And I'll explain that in just a second. So before we get into things, I want to give you a brief background as to how I started to do this, okay? Year 2000 roughly, graduated from chiropractic school. Prior to that, my degrees, biology, sports medicine. I worked in two rehab hospitals on the East Coast. I worked in an outpatient physical therapy setting. And a lot of the patients that I worked with were, hips and knee replacements, strokes, diabetes, prosthetic training, etc., right? A lot of major health conditions creating their problems. And then when I graduated chiropractic school, what I wanted to do, my objective was, let's put together my sports medicine training, my rehab training, the chiropractic approach, massage work, and let's work at kind of an integrated model to help these patients get better, okay? And for a lot of people, that worked really, really well. The patients it didn't work well with were my quote-unquote fibromyalgia patients. So real quick, if you've never heard the term, fibromyalgia is chronic fatigue and chronic pain, okay? Most of the people that see me, even though they haven't been diagnosed, they could be labeled as fibromyalgia, quite frankly. But what I want to say real quick to that is, it's just a word, so don't anchor to that. What fibromyalgia means is you have chronic pain and chronic fatigue because of a multitude of different dysfunctions in your body, okay? And that's what I want to get to. So we would have a lot of fibromyalgia patients come to see us because their backs and necks and shoulders and joints were not feeling real well, chronic pain, etc. And so we would adjust, we would do our techniques on them, our rehab, advanced rehab techniques, etc. Massage, health nutrition, what have you. And the reality is they just wouldn't get better. Okay, so they felt better that day or that night or 2 days later, whatever. But if we did a re-exam after 3 months or 4 months or 6 months or what have you, their pain and their fatigue were exactly the same. Their fibromyalgia really didn't change much. And so that led me down a path. The great thing about seeing a lot of those fibromyalgia patients was their files were very, very similar. A lot of them, if not, I'd say many to most of them, had gut issues, right? Irritability, bloating, gas, IBS, etc. A lot of them had poor liver function. A lot of them had autoimmune diseases already diagnosed. A lot of them had thyroid malfunction and adrenal malfunction and so forth, as far as their paperwork and maybe what somebody had diagnosed. And so that allowed me to understand that, there's maybe more going on to this than meets the eye. Meaning, if all those areas are malfunctioning, creating the chronic fatigue and chronic pain, as a chiropractor, I could work on them and maybe help manage some of their discomfort, right? But never get it truly better. And so once we started to put this together, I went to school. I went back to school, and one of the things on all of my websites under About Us, there's a link that will go into the amount of schooling that I've had. I've had probably, if I added it all up, 1,000+ hours in the areas of thyroid malfunction and autoimmune conditions and what causes them, in understanding blood chemistry, how to do the right testing to identify these things, etc. And you can read those. So what I'm telling you is based on a lot of extra schooling, because I wasn't getting people better with the techniques that I was using. So think about this. If we then started to apply the methods that I'm going to talk about a bit on how to heal, and we can start healing from the inside out and getting inflammation better and gut health better and thyroid's working better and adrenals and hormones and etc. working better, then the reality is the musculoskeletal complaints like chronic pain and sore joints and etc. started to get better without even me touching them. Okay, so if we apply the concepts that I told you about that I did initially, whether it's chiro care, massage work, rehab techniques, etc., but we first get their systems functioning better, the chiro, massage, etc. started to then work, because we were getting the causes corrected that were creating the symptoms, right? So in the same way that allopathic model uses maybe pain meds or uses certain medications just as band-aids, if the causes aren't addressed, then you'll always need the band-aid. And we're trying to do the exact opposite. That's the method, right, to the madness. That's the big picture approach. So the how to heal comes in with this functional medicine approach, is to identify specific causes, right? And then once identified, have protocols in place to be able to clean those up. And if you do that consistently, if you identify enough areas, so most of my patients we've been able to identify about 10 different areas that make up the nucleus of chronic pain, chronic fatigue, etc. And if those areas are identified, tested properly, okay, to identify them, and then have a nice functional medicine or cause-related approach to be able to correct the causes so the problem no longer exists, most people get well. It's very, very predictable, the outcomes, because there's no rock left unturned, okay? So when somebody comes in to see us, okay, the first thing I have them do is fill out paperwork. And that paperwork identifies these 10 areas. Now, I'm gonna break them down and just touch on them real quick. Digestive health, it asks you questions about your stomach, your small intestine, your large intestine. It will ask you questions about your gallbladder and liver, about blood glucose balance, your immune system, okay, your adrenal glands, which are your stress glands, your thyroid, your hormones, right, etc. It's going to ask you specific questions on about 10 to 11 areas that we found consistently malfunctioning in these chronic pain, chronic fatigue, fibromyalgia, autoimmune condition, thyroid-related issues consistently, okay? So the first thing we have them do is fill out a questionnaire. The questionnaire basically asks specific symptoms. If it's a 0, it means it never happens. If it's a 3, it means it's always there. And of course, 1 and 2 is somewhere in between, okay? So the first thing I want to do is open a file and see if there's 2s and 3s in a lot of those areas that we ask about. What that tells me right off the bat is that you're in the right place, okay? Because the shoe fits. Quite simply, it means that the things that I've studied and worked relentlessly on trying to understand, you have, right? And if that's the case, I tell Joni, my office manager, schedule this patient because they're in the right place, at least on paper, okay? You then come into the office, we sit down, and we do a complete history. I let the patient tell me, as long as they want, what their history was. When did it start? You know, what has transpired? Where are they now? What tests have they done? What doctors have they been to, etc. And what I'm trying to figure out is if our approach and what we're trying to do, A, has it been done before with that person, or were there some things missing, or was it not done at all? And that way we can get an idea if I can actually help them by using those 10 big areas that I just talked about, and there are more, I didn't list them all, but that we can go through and try to identify. And if we do that and we're thorough with it, we're going to be able to address each of those areas, okay, and then clean them up with very specific protocols. Now, the video after this that I'm going to have you watch is really going to get into the method to the madness. It's going to dissect all the areas, it's going to list all the areas, the flow chart, and then what tests are relevant to identify each of those areas malfunctioning in an individual patient, and then the what, when, how, why, how long, how much approach, if you will, or answering those questions as far as what supplements to use, what herbs and botanicals are proven to be able to change this or change that. And the idea being, like we talked about already, is if we can identify those areas, test them, then work on a protocol for each of those areas to help heal those areas, and then retest and show accountability. What I mean by that is if the labs change, the symptoms are better, there's accountability in our actions. So test, treat, retest mentality is huge as far as healing your body, okay? But again, the next video is going to tell you why it's so important to test these areas and that it's rarely done in the allopathic or conventional approach. Matter of fact, this mentality is often not done even in the alternative approach, right? So I'll give you a quick example. If we looked at the pill book in medicine, okay, or the herb and botanical book in alternative medicine, they're very similar, meaning if you have high cholesterol, take this statin medication. If you have this, take this. If you have that, take this. That's the pill book in medicine. In the herb and botanical book, in alternative medicine, it's listed the same, it's written the same way. If you have this symptom, take this herb or botanical. If you have this symptom, take that herb or botanical. The point that I want to make real quick is the mentality is the same, meaning I'm going to give you something to help band-aid your problem, but I'm not necessarily gonna work on the causes that created the problem. So this is the person that comes in on multiple medications and or multiple supplements, right, that really aren't getting any better because those supplements are really just band-aids. We don't want to do it that way. We want to identify the mechanisms, work to correct the mechanisms, and then get you off of those supplements. I'll give you a quick example. The gut health, right? So gut health can be compromised because of stomach acid issues. It could be an imbalance in the bacteria called dysbiosis. You could have leaky gut. You could have food sensitivities. You could have infections in the gut, etc. And so what we implement is something called a 5 R's program. Again, just giving you an example. It's called the 5 R's program. The first R is to remove foods that are known to be inflammatory to your gut. Gluten, transglutaminase, soy, dairy, etc. Okay? Processed foods, chemicals, toxins, what have you. The second R is to remove infections in the gut. So candida overgrowth, parasitic infections, bacterial infections like H. pylori, very, very common, okay? But they're often not tested and they're often not worked on properly, okay? So if we remove the foods, remove infections, we get better digestive enzymes, better probiotics, and then we're able to repair the mucosal lining from this thing called leaky gut, which is extremely real, 100% studied and identified. And we're able to heal the gut with that 5 R's program. Then what we can do is teach you to keep eating the right way so you're not breaking the gut down again, and then move on. So we're off of that protocol, and now we move on to another area of the body. And now we've healed the gut, and we no longer need X, Y, or Z supplements to do it because we've addressed the causes, okay? Real quick, there's also a method to that madness as to what to do first, because if we have infections in your gut, if you have infections in your gut or anybody, and you have inflammation in the body, inflammation causes leaky gut, which makes you more prone to infections, etc. So if we don't get the inflammation regulated and we don't get the infections out of the system, the other R's aren't going to work real well. So I know a lot of you have said, well, I've changed my diet, I've done this, and it hasn't helped much. Well, that's because it's number one, only one of 5 things we do for the gut, but it may only be one of 15 things we do for your entire body to get you healed. So just eating right is definitely a big part of it, but it's only one aspect of it. The point I'm trying to make is, with this functional medicine approach and using the gut as an example, we have to know not only what's going on in there, but we also have to know what to do, but when to do it is critical too. We've got to get the inflammation and the infections out of there first before the other R's have a chance to work. So if they're not done, right, the infections and the inflammation's not calmed down, somebody's going to be continually working on their gut probably forever, okay? So that's just one example of how this works, and from a detailed manner, getting really detailed in understanding that the what, why, when, how, all that is important, and each step of the way is important, okay? Bottom line is, if we go through those 10 areas that I talked about, and there's a right approach to clean each of those areas up, there's a very predictable outcome, right, that we want to achieve, that we will achieve with most people. And that is, you're going to be functioning better, you're going to be healing, and you're going to have less symptoms, and your body's going to feel significantly better, okay? The next video is going to really dissect it a little bit more for you so you understand. This one was just the big picture concept of this functional medicine approach and why it works so well. This is my opinion. This is the future of healthcare, okay? We are one of the sickest nations in the world, okay? We have the most chronic conditions, especially rates of chronic conditions, chronic pain, chronic fatigue of any nation in the world. So obviously what we're doing is not working. Our healthcare paradigm, unfortunately, is Band-Aids, right? A bunch of Band-Aids. Those Band-Aids may help you get out of danger, but there's a big difference of being out of danger and being healthy. This approach allows for your body to get healthy and to heal, okay? And it's in my opinion, again, I'll state this, it's my opinion, it's the right way to allow somebody to heal as opposed to just Band-Aid and allow them to maybe feel a little bit better. Big difference, okay? Big difference. Now, this ultimately comes down to, as a healthcare consumer, what you feel is right, or not really right or wrong, but better for you, right? And what you feel for you is best for you. That's what these videos are for, okay? They're not to entice you or try to sell you on anything. I love educating. I love informing people of things that I've learned that to me make a lot of sense. Why we're not healthy, why we're going this way as far as our health care and getting more and more of this disease and that problem, etc. And to me, I feel like I figured out why. And then what we're trying to do is learn every single day to make sure that we leave no rock unturned so that people can heal and get better. That's going to cost healthcare a lot less money over a long period of time if people are actually getting better. Okay? All right, so I hope that helped. The next video will give you a little more dissection on the 10 different things that we talked about, 10 or 11, and the labs that need to be done, and then what I call when the rubber meets the road, the what, when, how, why, how long, how much. Okay? So I hope this helped.